welcome to the first episode of The World of Healthcare, where we will discuss all things related to the medical field.
In today's episode, we will be discussing physician-assisted suicide by looking at an article on physician-assisted suicide and some of the complications and abuses that real patients have encountered because of this practice.
But before we dive into these cases, we would like to give more information on what PAS is. PAS is a controversial subject that raises questions surrounding the ethics and morals of this practice. Today, PAS has been legalized in 10 states in the U.S.
According to the American Medical Association, physician-assisted suicide occurs when a physician facilitates a patient's death by providing the necessary means or information to enable the patient to perform the life-ending act. The first case we will be looking at is about Kate Cheney, an 85-year-old woman from Oregon. She died by assisted suicide even though she had dementia, which reduced her mental capacity to make the decision to kill herself.
The first and second physicians Cheney saw refused to give in to her request due to this decrease in mental capacity, until she found a third doctor that would deem her mentally competent enough to make the decision.
What we see from this case is that even though Cheney was deemed unable to make the decision to kill herself due to her condition by 2 physicians and a psychological evaluation, she was still able to get what she wanted by seeing different doctors until they gave her what she wanted.
This is a phenomenon known as doctor shopping, where a patient will continue to see different doctors until they find one that will give them what they want.
This is how many patients avoid the safeguards put in place to prevent physician-assisted suicide for those that are not mentally capable of making the decision. In order to go through with physician-assisted suicide, you need a prescription for lethal medication from a doctor. It seems that there is no limit to how many doctors you can ask, so you can go see different doctors until one gives you what you want.
The second case we will be looking at is from Katherine Judson, who writes about how her ill husband was given a sales pitch for assisted suicide. Judson expresses her shock when she heard a physician talking to her husband about PAS and mentioned how much less of a burden he would be to his wife if he went through with the procedure.
This advice from a medical professional can be problematic mainly because it can be considered a violation of the Hippocratic Oath, which requires doctors to promise to help patients recover from illnesses rather than harm them.
Thank you for joining us in our first episode of The World of Healthcare. We hope today's episode was able to create more awareness on the assisted suicide and hope to spark more conversations on the harm PAS can cause.